Safety care training. The purpose of this training is to teach crisis prevention training program for staff who work with individuals with the potential for aggressive behavior. Philosophy, based on research from applied behavior analysis, utilizes concepts of behavior support, including reinforcement and antecedent interventions, focuses on identification and reinforcement of alternative behaviors. Set yourself up for success. 1. Get to know your student. Build a positive relationship with the student by getting to know their interests, their strengths, and background. 2. Create a safe environment. Minimize disorganization, clutter, and excessive stimulation. Dress for safety. Modify environment. Antecedent intervention definition. Antecedent intervention involves altering the environment before the behavior or concern occurs with the goal of preventing it from occurring. Antecedent interventions: choice, prompting, priming, high probability sequence, non-contingent reinforcement, time delay, contriving motivating operations, task itself. Choice is when one is given the opportunity to choose from more than one option. Example, choice of reinforcers or choice of two tasks. Prompts are instructions, gestures, demonstrations, touches, or other things that we arrange or do to increase the likelihood that clients will respond correctly. In other words, it is a specific form of assistance given by an adult before or as a learner attempts to use a skill. Example, use of partial physical prompt to teach child to use picture schedule properly, use of gestural prompt to indicate where to begin task. Priming is used to prepare children for a situation or task by providing them with relevant information beforehand. Transitions, preparing for new events, setting expectations. Example, giving a 2-minute warning before going in from outdoors. The high probability request sequence is when the adult presents easy tasks that the client consistently does on their own quickly before presenting the task that the client does not do. Example, asking 3 simple questions that client can answer easily before asking the new target question. Non-contingent reinforcement is when the client receives a reinforcer without having to work for it. Example, giving 2-minute access to a preferred app randomly in middle of a session. Time delay is when the adult prompts the client initially, but gradually delay when the prompt is given so they can learn to respond correctly on their own. Example, prompting a man immediately, then delaying the prompt by a few seconds to allow the client to mand on his own. Motivating operations is the internal desires of an individual that change and improve or lessen the value of a reinforcer. Example, a drink becomes more motivating after a client eats lots of chips. Task, task length, change how the instructional content is presented, task difficulty. Example, putting 3 matching tasks instead of 10. Recognize precursor behaviors. What are precursor behaviors? Behaviors that tend to occur immediately prior to problem behavior. Some children with autism flap their hands when they're excited and happy. Others flap their hands when they're beginning to feel stressed or anxious. How does your client you're working with demonstrate that he's upset or anxious? Precursors, advantage, identify behavioral antecedents so you can prevent problem behavior, allows you to intervene early before the client's behavior escalates. Precursors example, your client flaps his hands before he hits. Your client hums loudly before he hits his head with his hands. When to intervene. Intervention. Intervene with the right supports when your client engages in low levels of behavior to avoid escalation. Notice when low levels of behavior are beginning to increase in frequency or intensity. Begin using de-escalation techniques. De-escalation techniques. CPI's top 10 de-escalation tips. Be empathetic and non-judgmental. Respect personal space. Use non-threatening nonverbals. Avoid overreacting. Focus on feelings, ignore challenging questions, set limits, choose wisely what you insist upon, allow silence for reflection, allow time for decisions. De escalation tips: be empathetic and non judgmental. Your words can soothe and encourage your client and help to relax and de escalate their behavior. Respect your client's feelings and be compassionate. 2, respect personal space. Don't step in too closely. Give your client the personal space he needs to calm down. 3, use non threatening tone and body language. Be sure that your body language conveys acceptance and confidence, not conflict. Speak softly and in a calm tone of voice. Avoid overreacting. Be aware of your emotions and reactions to your client's behavior. Even if you are nervous, try not to let it show. 5, focus on feelings. Validate your client's feelings. You may not agree with those feelings, but they are real for your client. 6, ignore challenging questions. If a client challenges you, don't respond. Answering challenging questions increases the conflict and can cause problems behaviors to escalate. 7, set limits. Boundaries are important. You can give your client choices that are within limits to help him calm down and de escalate. 8, choose wisely what you insist upon. Suggest an alternative. Don't insist that things go your way. It may be necessary to allow your client to escape the task he is involved in. 9, allow silence for reflection. Don't be afraid of silence. Shared quiet moments can help your client reflect and relax. 10, allow time for decisions. Don't rush your client. Allow for a slower process to help him recover. Summary: use antecedent strategies first. Notice precursors and act upon them. Use de escalation tips when clients' behaviors are escalating. In case of a true emergency, call 911.